to prevent the spread of COVID-19. Clean your hands often. Use soap and water, or an alcohol-based hand rub. Maintain a safe distance from anyone who is coughing or sneezing. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Don't touch your eyes, nose or mouth. Stay home if you feel unwell. If you have a fever, cough and difficulty breathing, seek medical attention. Call in advance. Follow the directions of your local health authority. As some communities begin to reopen during the global coronavirus COVID-19 pandemic, public health officials say the best way to prevent illness is to avoid being exposed to this virus. Below are some steps from the Centers for Disease Control and Prevention to help protect yourself and others. Stay informed about what's happening in your community, and always follow the directions of state and local authorities. How to protect yourself and others. Wash your hands often with soap and water for at least 20 seconds, especially after being in a public place, or after blowing your nose, coughing or sneezing. If soap and water are not readily available, use a hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose and mouth with unwashed hands. Avoid close contact with people who are sick. Some people without symptoms may be able to spread the virus. Stay home as much as possible and avoid non-essential travel. Practice social distancing by keeping at least 6 feet, about 2 arm lengths, away from others if you must go out in public. Stay connected with loved ones through video and phone calls, texts and social media. Cover your mouth and nose with a cloth face cover when around others and when you must go out in public, such as to a grocery store. The cloth face cover is meant to protect other people in case you are infected. However, do not place cloth face coverings on young children under age 2, anyone who has trouble breathing, or is unconscious, incapacitated or otherwise unable to remove the mask without assistance. In addition, do not use a face mask meant for a healthcare worker. Continue to keep about 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. See CDC guidelines, including how to create your own cloth face cover. Cover your coughs and sneezes. Use a tissue to cover your nose and mouth, and throw used tissues in a lined trash can. If a tissue isn't available, cough or sneeze into your elbow, not your hands. Wash your hands immediately. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets and sinks. Follow CDC guidance. WHO is at a higher risk. According to the CDC, early information shows that older adults, people who live in a nursing home or long-term care facility, and individuals of any age with the conditions below are at higher risk of getting very sick from COVID-19. Have serious underlying medical conditions, particularly if not well controlled, such as heart, lung or liver disease, diabetes, moderate to severe asthma, severe obesity, and chronic kidney disease undergoing dialysis. Have a weakened immune system, including those undergoing cancer treatment, smoking and having other immunocompromised conditions. If you are at higher risk for serious illness from COVID-19, it is critical for you to stay home if possible and follow the other steps above. Avoid all cruise travel and non-essential air travel. call your health care provider if you have concerns or to ask about obtaining extra necessary medications in case you need to stay home for a prolonged period of time. Call a medical professional as soon as COVID-19 symptoms start, if you are at higher risk. See CDC guidance for more information for those at higher risk. If you are sick, COVID-19 symptoms include fever, coughing and shortness of breath, plus additional ones listed on the CDC website. Keep track of your symptoms, which may appear 2 to 14 days after exposure, and call to seek medical attention if your symptoms worsen, such as difficulty breathing. If you think you may have been exposed to COVID-19, contact your healthcare provider. Thank you, and subscribe to my channel Heart.